Hello, welcome to our channel. I am Dr. A. Umar. So in today's videos we are going to discuss the signs and symptoms of renal system diseases. So this video will come to you in two parts. We are going to begin with the signs as first part of our video, and then in the second part you will see the video talking about the symptoms of renal system diseases. So as we all know, signs means something that you maybe elicit or you see from your patients, not what your patient tells you. What your patient tells you, that's what is known as symptoms. So to begin with, let's introduce what's meant by renal system. So renal system consists of kidneys, the two kidneys, right and left, then ureters, the two connecting, let's say, tubules that connect the two kidneys with the bladder. Then we have we have the bladder and the urethra through which the urine passes out. So the sign of diseases related to this system, that's the renal system, include the following. Firstly, we have the confusion and loss of consciousness. This may occur in patients with uremia. Thus, uremia simply means a high level of urea in the blood. Emia means blood. So when there is a high level of urea in the blood, that's what is known as uremia. So when there is decrease or when there is diseases or renal failure, the next thing is there will be affectation of metabolism of amino acid. So there will be increase in the metabolism of amino acid. Increase in metabolism of amino acid through the urea cycle will now causes increase in production of urea. When there is high increase in level of urea, the normal value is mostly 77 to 99 milligram per dl. So when there is when the level of this urea is beyond this normal value in the blood due to increase in activation of urea cycle, then there will be increase in the level of urea. So urea is toxic, and so it accumulates as a result of no compensatory mechanism that will remove this ammonia from the body through excretion. You know, urea is excreted out from the blood by the renal system. So when renal system fails to excrete this high level of urea from the blood, then it will continue to accumulate, and then the accumulation of the urea in the brain causes affectation of the brain by causing decrease or increase in the level of either inhibitory or excitatory neurotransmitters, as well as also causing effect on some neurons in the brain. So when there is affectation of the brain, then the patient with the renal system disease will now have confusion and loss of consciousness. This may progress to coma or even death if care is not taken. Then the next sign of renal system disease is facial edema. So the facial edema, it is as a result of salt and fluid retention. So the edema, you know, as a result of salt retention, the renal system is responsible for excretion of salt from the body when there is increase in the level of that salt in the blood beyond normal. So when the kidneys or the renal system fails to excrete this salt, then it will accumulate within the extracellular spaces or even the intracellular spaces. So accumulation of the salt in the ECF now will causes movement of water into that space. Normal movement of water normally is along the concentration. Water or any fluid is along the concentration gradient. So when there is build of this concentration of salt in the extracellular space, then the fluid now will follow into that space. Follow of this water will now continue until the level of water is high. So there is accumulation of fluid in that extracellular space. So this accumulation of fluid, that's retention of salt and fluid, now will causes edema. So the edema firstly begins from the pest in the renal system diseases. At times is preorbital edema. As you can see from this picture, there is a preorbital edema. So the preorbital edema will now let your patient to look like as if it forms an eyeglasses for the guy. Then there will be puffy pale face, and also lips of the patient may be swelling. So in the second picture, you can see the patient is having like general facial edema. So when there is generalized facial edema, so the individual is said to have renal diseases or renal failure unless proven otherwise. So the edema can later spread to other parts of the body and become generalized as a result of maybe the care is not taken. So the edema will now continue and then causes more and more swelling of the body until it becomes generalized. So the next sign is number 3, that's the uremic frost. These are tiny urea crystals that deposit on skin, which result in frosted appearance as sweat evaporate. Normally, in an individual that has renal system diseases or failure, there is increase in the level of urea. So when an individual has increased level of urea, then the appearance on the skin of an individual is frosted like appearance. So this frosted like appearance is also an indication to this kind of renal failure or diseases. So it can be found in patients with uremia and is commonly found in beard, other part of the face, neck, trunk, even hands. So if we look at this picture, we will see that this hand, there is a whitish deposition, which is uremic frost. Also in the face of this individual, we will see there is this whitish something. So this is an indication of renal diseases or renal failure. So this is what we call uremic frost. Especially those living in desert, even in normal individual, when there is hot temperature or in hot environment, so they will profusely sweat. So when they sweat and this sweat evaporates, then the next thing is after dryness, you will see something like salt deposition on their body. So also in an individual renal diseases, you can see uremic frost. So then the next sign is Lindsay's nails. The proximal portion of each nail bed will now appear whitish, and the distal portion is red, or it may be red, pink, or even brown. So in this, if we look at this 4 fingers, we will see the proximal portion is whitish in appearance, then the distal portion is reddish, so also it may be brown or pink. So between these 2 portions, that's between the reddish distal part and whitish proximal part, we will see there is a clear demarcation. So this is an indication, or this is a condition known as Lindsell's. So note that it occurs in about 40% of patients with CKD. CKD, that's chronic kidney diseases. So in chronic kidney diseases, it's not every patient that will present with Lindsell's. Rather, it's only 40%. So Lindsell's disease in renal diseases or renal failure is also an indication of that disease, so or failure. The next thing is pallor. Patients with kidney diseases usually come up with anemia, and anemia, that's lack or inadequate level of oxygen in the blood. Anemia means blood, then anemia means lack of adequate oxygen in the blood. So normally in the blood, this inadequate oxygen delivery to the tissue is due to maybe decrease in the number of red blood cells or decrease in the amount of hemoglobin. Hemoglobin is the one responsible in binding with oxygen. So when there is when blood crosses along the lungs, and then the respiratory mechanism takes place, then there will be exchange of carbon dioxide with oxygen. So this oxygen now will be carried by hemoglobin, which is present in the red blood cell, to the peripheral tissues for oxygenation. So it is as a result of decline in production of erythropoietin. Erythropoietin is a hormone responsible for or required for erythropoiesis. Erythropoiesis is a process whereby red blood cells are produced in the body. So when there is decrease in the level of erythropoietin production due to affectation of the renal system or failure of kidney, so the next thing is decrease in the level of erythropoietin. About 90% of erythropoietin in human body are produced by kidney. It's only a minor quantity, about 10%, that's produced in the other organ, that's the liver. So when there is renal disease or renal or kidney failure, then this about 90%, which is almost all the total level, all the total amount of erythropoietin in the body, now will decrease. So decrease in this erythropoietin now will decrease the erythropoiesis. Decrease in erythropoiesis, there will be decrease in red blood cells production. Decrease in red blood cell production will now result into anemia. So the presentation of anemia or the sign of anemia that we'll see in the patient by physical examination is pallor. So this pallor can be checked from the conjunctiva of eye. If you look at this one, you see in this picture the conjunctiva is pale, which means that the individual has anemia. Then if you look at the other pictures, you will see in this farm tongue already the areas in the body or site in the body where you can check pallor are. You can check it from conjunctiva, palm, tongue, submucosa, and then even nail beds. So in these palms, you will see the little one, the smaller one is pale, and then the other one is not pale. So this is normal hand, this one does not pale. So in this pale hand is an indication that the individual has anemia. So in the hospital setting, normally you will compare the hand of your patient that's suspected to be pale with your hand. But if it is a lady, it is advisable to use the hand of another lady to compare with the hand of the patient, because of there is difference between the level of oxygenation in man and in human. So if you look at also the other pictures, you will see the first one from the above, the first one is not pale, so the individual is normal. But the one at the middle, you will see the tongue is pale, and then in severe condition, if you check the tongue, it will be severely pale. So this is an indication that an individual has anemia. So the presentation of this anemia is seen pallor in that patient. Then the next sign that you can see is hard nodules. So in an individual with renal or kidney diseases, so you can see if you check beneath the penis of an individual, you can see hard nodules. So these hard nodules are mostly seen in condition like urethral stricture. Urethral stricture means when there is constriction of urethra. So abnormal constriction of urethra will now result into formation of some hard nodules beneath the patient penis. So this is also a sign of renal system diseases or kidney failure. Then the next thing is tenderness in suprapubic area. This usually is as a result of cystitis or distension of bladder. Usually the tenderness in the suprapubic area of a patient with renal kidney diseases is as a result of obstruction or affectation of lower renal system. So when there is affectation like distension of bladder, is also part of the lower renal system. So when there is affectation of this, also cystitis, then it will causes the individual to feel pain when it is elicited in the suprapubic area. So this is a cardinal feature when it comes to renal system medicine. So then the next thing is renal breaths. These are swishing sounds that are sometimes heard in renal artery stenosis. When you examine your patient with stethoscope, so in condition like renal artery stenosis, you will feel from your stethoscope swishing sound, some swishing sound. So this swishing sound, if you look at this picture, this is where you have to place your stethoscope. So when you place your stethoscope here, if an individual is having a renal artery stenosis or condition like that, then you will feel or you will have renal system. If you check this point, you will have swishing sounds from your stethoscope. So it is an important examination that's carried out in people with renal system diseases. Also, the next thing is renal angle tenderness. Renal angle tenderness usually is when there is inflammation of the kidney. Inflammation of the kidney maybe by due to certain, let's say maybe kidney, maybe cancer, or due to some infections, because most of kidney diseases that present with inflammation are caused by infections. So when there is inflammation, then you can elicit pain in your patient at costovertebral angle. If you look at this diagram, you will see this this is a patient, then the hand is placed at the costovertebral angle. Costo means rib, so, and vertebral, that's the vertebral column, that's the backbone. When you take an angle between these two, the costa, the 12th rib of your patient, and then between that and vertebral column, then you place your hand and then you hit a little bit, not the way that you will elicit much pain on your patient, rather just to examine. So you just place your hand and then you hit a bit to see the reaction of your patient. Then, so if the two kidneys, if the kidney is inflamed, then the individual will feel pain. If it's only one kidney, then you elicit this pain on normal and abnormal kidney, so that you compare the two. If it is both kidneys that are affected, then whenever you hit for the first or the second one, then the individual will feel pain. So tenderness in the renal angle is also a sign of renal system diseases. Then we have also the next video that will talk about the symptoms, which will be the part 2 of this system. So thank you for watching. See you next time.